Are you confused by candidates' healthcare plans? You're not alone.
Nobody knew that healthcare could be so complicated.
Don't worry, we got you. Healthcare has been one of the most contentious issues in the debates, and the Dems' plans fall basically into two camps.
Single-payer program.
Or
public option.
Some of the candidates are a little dodgy on where they fall, but it's roughly this. Yes, Booker's up there twice. He said he'll go for whichever approach has the best shot of getting passed. And Kamala's actually kind of in between the two, which I'll explain in a minute. So let's start with single payer. Single payer may sound like a terrible dating app, but it's really just a terrible name for healthcare paid for by the government. That's who the single payer is. This is what most of the world does, and it seems to work out pretty well. Most advanced industrial nations spend half of what the US does on healthcare, and they get better results. Now, clearly, Bernie Sanders realized single payer wasn't a good name because he successfully rebranded his version of it as
Medicare for all.
Now, different countries do single payer differently. Bernie's plan is not like Britain's system where doctors are government employees.
Ah, I see you have the machine that goes bing!
It's more like Canada's, where doctors and hospitals are still private, but the government pays the bills, as if it were one giant insurance company. And it's important to note that since the care is still provided by the private sector, it's not really honest to call it
Socialism.
But Bernie's plan is actually more ambitious than Canada's. Everyone's covered. It covers dental, vision, long-term care. You pay no premiums, no copays. Going to the doctor costs you nothing. Now, there's still out-of-pocket costs for prescription drugs, but they're expected to be much lower. So what's the catch? Well, it's expected to cost over $32 trillion over 10 years. That's trillion with a T. Sanders claims that's actually a $2 trillion savings over what the nation would spend on healthcare without it. So how do we pay for it?
The wealthiest, top 1/10%, start paying their fair share of taxes.
Well, that's part of it, but Sanders is also proposing a 4% tax increase on everyone earning over $29,000. He says that even if you'll be paying more in taxes, you'll still be paying less overall because you'll be getting free health care with no insurance premiums. Now, Elizabeth Warren's Medicare for All offers similar coverage, but she's got a different plan to pay for it. She says there'll be no tax increase for middle-class families. She'll just pay for it by taxing the rich, corporations, and cracking down on some loopholes. Now, where it gets confusing is that there are other candidates, like Kamala Harris and Andrew Yang, who are also calling their plans Medicare for All, but they're not, strictly speaking, single-payer plans. So that brings us to the public option. That's where the government sets up a healthcare service that competes with the private sector. So instead of Medicare for all, it's more like
Medicare for all who want it.
Exactly. Supporters say it will force private companies to up their game. If they can't provide the same or better services at the same or cheaper prices, they'll lose business. Many analysts think a public option will inevitably lead to a single-payer system, because profit-motivated companies will never be able to cover care as affordably as the government. And everyone will eventually move onto the public plan. Critics on the right say it's a government takeover of healthcare. Critics on the left say it doesn't go far enough, and it isn't aspirational enough to inspire the broad grassroots support that's going to be needed to get any major health reform passed. Now, Kamala Harris' plan is actually sort of a middle ground between public option and single payer, because her public plan becomes the default. Everyone who is currently uninsured gets enrolled automatically, so it achieves the goal of universal health coverage. And while private plans can continue to exist, there will be stronger regulations on what they have to cover and how much they can charge. And, moving forward, everyone automatically gets enrolled at birth on the public plan unless they opt out. And that would naturally tend to phase the private plans out. So that's where the Democrats are. On the other side of the aisle, there's Trump's plan, which isn't actually a plan.
Repeal and replace with something terrific.
4 years later, he's still trying to repeal, but he doesn't have a plan to replace. And that means if he gets his way, 20 million people lose coverage. And 130 million people with pre-existing conditions could be charged more or denied coverage. So, for everyone out there who likes to pretend that the two parties are just the same, it's important to remember that even the most conservative Democratic plan is still aiming for universal coverage and still would preserve the protections of Obamacare. Because while there are real differences in how they want to get there, every Democrat on the stage believes that health care is a basic human right.